and post-resuscitation care helps to restore quality of life.
Tara, are you all right? Help! Can somebody help?
Do you know what you're doing, or do you want to get a first aid?
We need an ambulance. She's unconscious, but she's breathing.
What happened?
I'm not sure. I just found her like this. Please, can you call an ambulance as quick as possible?
I'll get to the phone. Are you sure you're okay?
I'll be fine. Just be quick.
Ambulance, please.
Service. Go ahead, caller. What's the suggestion of the ambulance?
I'm at Bristol Street, Justice Street.
Can you confirm your telephone number?
Yes, it's 0117 924 6953.
And that's Bristol Eye Street and Chester Street.
Yes, that's correct.
What's the problem there?
The young woman's collapsed on the side of the road.
And how old is she?
I don't know, maybe 18. Quite young.
Is she conscious?
No, she's unconscious.
And is she breathing?
Seems to be, yes.
Is she diabetic?
I don't know.
Does she have any heart problems?
Sorry, I really don't know.
And is she breathing normally?
Yes, I think so.
Okay, I'm going to give you advice on how to maintain her airway.
It's okay, she's with a friend who seems to know what she's doing.
Okay, if her condition worsens in any way, call me back immediately for further instructions.
Okay, thanks.
Yeah, I'm going to be with you as soon as it can.
There's an ambulance on its way.
If you ever find yourself in an emergency situation like this, where someone appears to be unconscious, first check for danger. Make sure the casualty, any bystanders and you are safe. Then check response. Gently shake her shoulders and ask her loudly, "Are you all right?" If she doesn't respond, shout for help. Next, you need to open her airway. When someone's unconscious, the tongue can sometimes fall back and block the airway. To open the airway, place one hand on the forehead and tilt the head back. Using two fingertips of the other hand, lift the chin. You need to know if she's breathing normally. You do this by looking for chest movements, listening at the mouth for breath sounds, and feeling for breath on your cheek. Take no more than 10 seconds to do this. In the first few minutes after cardiac arrest, a victim may be barely breathing or taking infrequent, noisy gasps. Don't confuse this with normal breathing. If she's unconscious but is still breathing, you need to put her into the recovery position. This allows the tongue to fall forward, keeping the airway clear. It also reduces the risk of any vomit blocking the air passages. Kneel beside her, and if she's wearing glasses, remove them. Make sure her legs are straight. Place the arm nearest to you out at right angles to her body. Elbow bent with the palm of the hand uppermost. Bring the arm furthest from you across the chest. Hold the back of her hand against the cheek nearest to you. Then with your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Keeping the hand pressed to the cheek, pull on the thigh to roll her onto her side towards you. Adjust the upper leg so that both the hip and knee are bent at right angles to prevent her rolling onto her face. Tilt her head back to ensure that the airway stays open. Adjust the hand under the cheek, if necessary, to keep the head tilted. And check her breathing regularly. If you've not already done so, send someone to phone 999 or 112 for an ambulance. If you're on your own, you need to leave the casualty in the recovery position and do this yourself. The operator will connect you to the ambulance service and will ask you some questions such as your telephone number, the location of the incident, and what's happened. Remember to stay calm, listen carefully, and speak clearly. Answering these questions is important and won't delay the ambulance. Once you know help's on its way, stay with her until the ambulance arrives and recheck for signs of breathing at regular intervals.
Clear? How to take a casualty to a recovery position was demonstrated. So you are confident of doing this? I'm not getting a proper
Yes.
For what? You know, who put the person in that position? What? Why this position?
Yeah. Why is this position?
To breathe properly.
To make sure that the casualty is breathing properly. Because we are taking a casualty to a recovery position when they are unconscious and they are breathing properly. But since they are unconscious, chances are there that the tongue may slip down and block the airway. So we have to make sure that they are breathing properly. So we cannot hold this position for the next 10 to 15 minutes till ambulance comes. Practically that is not feasible. So we are taking them to a position where the airway will be open. So while doing that, you might have seen he just adjusted her head, tilted her head a little back side, right? So the same thing you are doing. You are actually positioning them in a particular direction and then you are tilting the head. This is the important part. Tilting the head is the important part. Rest of the adjustments in hand, leg, etc. You are doing it just to stabilize the body. It should not be like you leave them in that position and once you move, they should not actually fall onto any of the sides. So stability should be there. So for that only you are adjusting the legs and hand, etc. The important part is tilting that head a little back.
Should be right side only or?
That was my next question. Which is the best side to take to? Should it be to the right? Should it be to the left?
Left.
Huh?
Right.
Yeah, right or left? Two answers I give. Right?
Right.
Like left is the best side. There is no hard and fast rules like it should be to the right or it should be to the left. You can take them to any side, no problem. But from right and left is the best position. If you ask me why, like after having food or drinks, if immediately someone is actually in this particular scenario, if you take them to the left, the food and drinks will be inside the stomach itself. If you are taking them to their left, because stomach is on the left side. But if you are taking them to the right side, possibilities are there. This might, travel back, they may vomit or it will get mixed inside the lungs. That is also possible since they are unconscious. So, if possible, take them to the left. If there is no problem to take them to the left side, that is what is suggested. Otherwise, some cases, if they have a fracture in the right hand and all, you cannot keep that fractured hand like this. You cannot hold it and etc. So you will have to take them to the left side. Depends. Every time the injured, if there is any injury, that injured side should be facing down. clear, right? How to take someone to a recovery position.
In the, if leg is fractured, so the fractured leg should be outside.
Like you have to position in such a way that no movement should be there to that fractured part. For anywhere on the body if there is fracture, your primary goal is to prevent any movements to that particular body part. So likewise you have to do it. You have to think in which side
If
the
probably
movement.
if possibility if he has fracture on shoulder, we cannot put him on the recovery position that scenario in that case.
Now, in that scenario, you will have to tackle it accordingly. If there is a shoulder fracture and all, like yeah, you can actually assist them. You can give a support there. It is not like, see, you asked me regarding the leg fracture also, right? So if the both legs are also fractured, you cannot adjust the legs. So there, what you are supposed to do is take them to that position and hold the leg in that place. Straightly you have to hold. Likewise, if there is a shoulder fracture also, you can actually hold it, support it for 10 minutes. That is
Or
possible.
something under the shoulder or something.
Yeah, some kind of like support so that further movements will not be there. It will be easy for them. Like that, you can do. The thing is, you cannot hold like this for 10 minutes. That is going to hurt their back of their head, as well as that will be possible for you also. But providing a support at some of the sides is actually possible. Then you can. So till what time? Again, like I said, 5 to 10 minutes till the ambulance comes. That is the time when you have to see all this stuff. Then they will take care of the rest. Okay. Any other questions regarding recovery or any procedures that was done?
All students ask that question every time I ask them.
So you are pretty much sure, clear, right? How to take some.
Yes, yes.
So one short video I will again show just the recovery question of the whole story.
If you've done a primary survey and established that your cavity is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and label the objects in their pockets, but do not search their pockets for small items. Make sure both of the classmates' legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bend across the chest and place the back of the hand against the cheek nearest to you and hold it there. With the other hand, lift the far knee up until the foot is flat on the floor. Whilst keeping the plasmid's hand pressed against your cheek, turn the far leg and carefully roll the plasmid towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Turn the plasmid's head back so that the area remains open. If needed, adjust the hand under the cheek to help to keep the area open. If it has not already been done, call 999 or 112 for emergency help.
Okay? Any doubts? So this is regarding a scale. There is a scale, like when medical professionals communicate among themselves, they use this. This is not for you, but then there is a scale called ABPU scale. A is when the casualties are, B if they are responding to voice, B if they are responding to prevent, Q for unresponsive. It's called ABPU scale. Now after the primary survey, then comes the secondary assessment. So here what you are doing is you will plan on the diagnosis. What is diagnosis? Depending on history, sign and symptoms, you will plan on what you are supposed to do hereafter. That's diagnosis. And Yeah, history like what happened, the medical history. Did anyone see what had happened regarding that? You can just get inquire. Then signs like what you see, feel and smell, etc. You can note that, and then symptoms like what the casualty is feeling, etc. You can ask. So depending on these three, you will plan for the diagnosis. What you are supposed to do regarding that. That is a secondary assessment that you do. So in secondary assessment, you are supposed to conduct a top-to-toe survey. Physically, you have to examine head and face, neck, shoulder, chest, arm, spine, pelvis, abdomen, extremity. So whatever physically you can examine, you have to do that. That comes in secondary assessment. So then the next major step, that is resuscitation. What is the full form of CPR?
Cardiopulmonary
Resuscitation. Okay. That's
hard to pronounce.
Cardiopulmonary resuscitation. That is CPR, the process like by which you. When are you going to do this? Like I said, what is the condition of the casualty? Are they conscious or unconscious? Unconscious. Are they breathing or not breathing? Not breathing. So when someone is not breathing, their heart will stop pumping, right? Literally, we can also say that the person is almost dead. Like when we die, heart will stop pumping. So we are trying to bring them back from dead actually. We can put it like this also. So after performing the CPR, the chances that this heart will start again. The heart will start again after performing the whole CPR. The percentage is like from 2 to 5%. But that doesn't mean you should not try. Even if it is 0.1% also, we have to do our best in order to bring them back. So how to do the CPR we'll see. So it is also called the chain of survival. Early recognition and call for help. So recognize it as soon as possible. So contact the emergency number as soon as possible. Everything should be quick. You should not be wasting even a second. So early CPR is good, and early defibrillation. What is defibrillation? What is defibrillation? Defibrillation. Aha, I got it there. Because he was answering everything. What is defibrillation? You would have seen on movies like giving the electric shock on the chest. That is called defibrillation. Even Mr. Bean is doing that, right? But don't do in that way. He had connected it to the post, and no, not that way. But that is what we call defibrillation, giving the electric shock. Okay. Why we are giving the electric shock? In order to restore the rhythm of the heart again. Just to start the heart, we are doing that. So there is a machine called AED. What is AED? Anabemeres drum. That is only AED, you know, right? Only you got that AED. No, this is automated external defibrillator. So this is the machine. Kind of it looks like a weighing machine, but that's an AED. Automated external defibrillator. So if you have this machine in your workplace, you don't have. Okay, so if you have one, you can actually give that electric shock by yourself. It is very easy. So we have a piece here. It is actually a demo piece. Actually, we can't use it on human, but this is just for the demonstration purpose. So if there will be a machine like this, and 2 pads will be there along with that, and a means to connect it to the machine. So what we will do is, we'll connect this to the machine. We'll turn it on. But before turning it on, you have to stick these pads. So on the pads, it is clearly given like on what part you have to stick. These pads is clearly mentioned on the pad. So one is on the upper left, just over here. The other one is like over here. And then after, like, you have to remove this and you have to connect. After connecting, turn it on. It will instruct, you just have to follow.
Analyzing heart rhythm.
Analyzing heart rhythm.
Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
So that button will start to play. That time you just have to press
Shock delivered.
the man will just jump. Shock will be delivered.
Begin CPR.
begin CPR. So this will give you clear instructions, you just have to follow. So before inventing this machine, how this went was like the ambulance will come, there will be a doctor inside. So he will look for the ECG of the casualty. He will check the ECG and the doctor was the one who decides on what impulse of shock must be delivered to the casualty. That was decided by the doctor. So there the problem is we are wasting some time because it will take 10-15 minutes for the doctor to do this. So if you have one machine like this with you, you can directly give that electric shock as soon as possible. The probability is that they might be recovered is higher. Provided you should have at least one. So this is an AED. So defibrillators give an electric shock to reorganize the rhythm of the heart. So any defibrillation is suggested. Then post resuscitation care is like you hand over the casualty to the medical team. So how long you are supposed to continue this CPR? CPR is like there will be 30 chest compressions. The chest compressions that you do, 30 chest compressions followed by 2 effective rescue breaths. That is how you do the CPR. So 30, then this 2 rescue breath, 1 and 2. Again 30, then this cycle will continue. Till when?
Until the ambulance will arrive.
Until they come and they take over. It is not like you are on the 10th floor of the building, ambulance came in the ground floor and you can stop. No. They have to come there and collect the casualty. Till that you are supposed to continue the CPR. That is one case. Otherwise, until the casualty starts to breathe, you are supposed to continue. Clear? So how to do a CPR is like 30 chest compressions and 2 effective rescue breaths. So this is the conventional way of doing the CPR, and this is always an optional part right from the beginning. This is always optional. If you are comfortable, do this, otherwise you can skip this part and just continue with the chest compression. Clear?
Optional, we can use some piece of cloth or something.
Exactly. Is there? So there is something called a face shield is available. You can use a face shield in order to give the rescue breath. Like you can place the shield over there and then I had one, but I don't know. So this is a face shield. So you have a green side, a green sticker is here, as well as a red side is also there. So the red side should go down, the green should be facing upwards, and this provision should come at their mouth. So it should be like you have to place it like this. That provision should be exactly on the mouth. Then through this you can give the rescue breath. That is it. This is called a face shield. Many other things are also there. There are resuscitors which is available. You can use that resuscitors in order to give that. And also some kind of balloon-like stuff is there, which you can just place on that and you can pump air. That is also possible. So if those kind of stuff is available with your workplace, go for that. Otherwise, like I said, this is always an optional part. It is always good to do something rather than leaving them there. So go with the chest compression. So if you are doing only the chest compression, no need to count. But if you are doing both of this, it should be like 32 and 32. That cycle should continue. This is an adult CPR. This is not applicable for children and infants. It is different. Children who haven't reached the age of puberty, for them you will use only one hand in order to give the CPR. It is not included in our post, but I am sharing this because you should not be doing this on children and kids. That is it. Okay, so there only one hand you will use, and the compression is like around 1 to 2 centimeters. Here the compression is around 4 to 5 centimeters. How much you are compressing their chest? It is 4 to 5 centimeters. For children, 1 to 2 centimeters. Again for infants also it is 1 to 2 centimeters, but there you are using only 2 fingers in order to do the compression. So it is different.
One common question, I know the answer, but I think it's better to explain to them. We inhale oxygen, we need oxygen, right?
Yeah.
Then we out carbon dioxide.
Yeah.
On that case, on second case, when we give them breath, how? because we are out carbon dioxide.
We are giving out carbon dioxide.
Actually, we need oxygen.
To breathe, yeah, of course, human needs oxygen to breathe. But what we are doing here,
We are restarting the breathing.
just trying to start the heart. So it is not like we can bring that oxygen cylinder and connect and then that is going to take a lot of time, right? Manually, what we are trying to do is we are trying to start that heart. So what we can do is give relative carbon dioxide, but we are trying to start that heart.
Even people, when they smoke, they don't die because they take carbon dioxide.
Yes. By smoking,
But
it's
sir,
not
I have a question. But they still execute that second, given the situation.
No.
Okay.
Like we have a new updated guideline
Yeah,
also.
because of the
From,
situation today.
yes, from 2020, the guidelines are updated. Again, sad news, this part had been eliminated. Because we have the pandemic. Because of corona, that part had been eliminated. But then why I am actually explaining the whole stuff is like you can do it in your family, no problem. If someone is sick, if this is necessary, you can do it there. That is why I am explaining the whole stuff. But now you cannot do this because of corona. Only go with the chest compression. So like I said, only if you are going with the chest compression, no need to count. That rhythm should be proper. That is why we are doing the practical here. Theoretically speaking, everything will be like, you people will not that. Yeah. But then when doing the practical, we'll see how it goes. So yes, we have a clip on how to do the CPR. Yes.
Sleep well tonight?
Absolutely exhausted.
Well, let's face it, we're not as young as we were. Do you want a coffee? Tony, what's the matter? Are you alright? Oh my God, Tony, speak to me. Help! Breathe, Tony, breathe.
Emergency services, which service do you require?
Ambulance, please.
An ambulance will be with you as soon as it can. You're going to need to put him on his back.
It's okay, I know. I've done CPR training. I've just never had to actually do it.
Okay, well, I'm going to stay on the line, so come back to me if you need to speak to me.
Okay, yes, thank you. like this. I phoned for an ambulance.
Is he breathing?
No.
We've got a defibrillator up here.
But keep going. You're doing really well.
As quick as I can, okay? Feel one pad from plastic liner. Place one pad on bare upper chest. Feel second pad and place on bare lower chest as shown. Feel second pad and place on bare lower chest as shown. Analyzing movement.
Stand back.
Stand clear. Push suction button to deliver shock. Start CPR. If you ever find yourself in an emergency situation like this, where someone appears to be unconscious, check for danger. Then check response. Gently shake his shoulders and ask him loudly, "What's happened? Are you all right?" If he doesn't respond, shout for help. You need to open his airway and check for normal breathing. If he's not breathing normally, or you have any doubt, send someone to phone 999 or 112 for an ambulance. If you're on your own, you need to leave the casualty and do this yourself. Once you know that help's on its way, you need to start chest compression. Kneel by the side of the casualty. Place the heel of one hand in the center of his chest. Then place the heel of your other hand on top of the first hand. Interlock the fingers of your hands and ensure that pressure is not applied over the casualty's ribs. You then need to position yourself vertically above the casualty's chest. With your arms straight, press down on the breastbone 4 to 5 centimeters. That's 1.5 to 2 inches. After each compression, release all the pressure on the chest, but without losing contact between your hands and the chest. Repeat at a rate of about 100 times a minute. That's a little less than 2 compressions a second. Compression and release should take an equal amount of time. After 30 compressions, you should give 2 rescue breaths. Open the airway again and pinch the soft part of his nose closed, using the index finger and the thumb of your hand on his forehead. Allow his mouth to open, but keep his chin lifted. Then take a normal breath and place your lips around his mouth, making sure that you have a good seal. Blow steadily into his mouth. Take about 1 second to make his chest rise as in normal breathing. This is an effective rescue breath. Maintain your head tilt and chin lift. Take your mouth away from the casualty and watch for his chest to fall as air comes out. Then take another normal breath and blow into the casualty's mouth again. You need to give a total of 2 effective rescue breaths. After the 2 rescue breaths, return your hands without delay to the correct position on the breastbone, and give a further 30 chest compressions, then another 2 rescue breaths, and so on. This is called cardiopulmonary resuscitation, or CPR. Only stop if the casualty shows signs of life or you become exhausted. Don't expect the casualty to recover at this stage. You probably need to continue CPR until professional help arrives and takes over. A useful way to remember this procedure is to think of the ABC rules of resuscitation. Airway. The airway has to be open and clear so that the air can get to the lungs. Breathing. You need to check if the casualty is breathing normally. CPR. You need to perform chest compression combined with rescue breathing. A, B, C. If you're unable or unwilling to give rescue breaths, then just do chest compression. It's much better than doing nothing at all. Once help arrives, they will use an electrical device called a defibrillator. This is designed to give a controlled electrical shock to the heart. This may get it back into a rhythm that allows the heart to pump blood around the body.
Spontaneous respiration is TCS. The condition is as we see no previous history, no medication.
Clear? Okay, so now we start the practicals, okay? You have to explain the whole primary circuit. D, R, A, B, C, everything you have to say here. And how this goes is like I will demonstrate. So, we have a casualty. First thing to do, get the gloves.